So yeah, I'm so happy that we meet here.
Sure.
And that we can talk about this, because last time when we met, I found out that we both have similar interests. Actually,
Yeah.
that was really amazing. Actually, it followed me for a while, because it also reignited some very old memories of my father having asthma. That was really horrible time for me, actually, because I remember that my parents, they were often racing to the hospital with him. And I remember one day we were outside. I was little, and we were just somewhere in North Germany, and everything was super fine. The weather was good, and then my mother found out that she forgot this asthma inhaler. And the fact that my father became aware that the asthma inhaler was not present in the car made him instantly turn into a nearly pre-asthmatic shock.
Sure.
It was really horrible, and we had to call the ambulance. And that was one of the memories that I have about that. Anyway, since then, it always stayed in my mind. And then I followed, obviously, the medical pathway, and eventually, only actually a few years ago, I was contemplating about the nose, because I did so many nose surgeries, and I found out, actually, why are we all trying to make the nose wider inside, although it starts already with these little two nostrils. So now I'm so super happy to have Dr. Sherif Mandour, yeah?
Yes,
Is this
exactly.
correct? Dr.
Correct.
Sherif Mandour, he is a pharmacist from Egypt,
Yes.
correct?
Sure.
Yeah. And we know each other for a while, and I'm really excited to have you here. I'm happy to have you here, because you are sharing this interest in breathing problems with me.
Sure.
Now you're working not as a pharmacist anymore. Now you're with a different company.
Yes. Actually, since my graduation, I worked for a couple of years as a community pharmacist, and then I moved immediately to be joining pharmaceutical companies, medical devices companies. Right now, I'm with Sharp, the Japanese brand that's very well known. I'm responsible for the healthcare products over the Middle East, Africa, CIS countries. And I think that the main topic that we may be interested to talk about today, related to the whole asthma and allergy, will be the air purifiers, which is one of the products that I'm leading in Sharp at the moment.
How did it come that you have developed an interest in electronics, and then in air purifiers? What is the background behind it? It's an exciting story, I think.
Actually, it's kind of like similar to the story that you have just shared. I'm asthmatic myself since childhood, and that had affected my life to a great extent.
Yeah.
And usually the asthmatic people tend to stay more indoors, and of course you will read more or like watch TV or whatever. So because of this, I started to read more about the some of the medical books, for example, and I became interested, and I went to pharmacy school. And since I was graduated, all of the therapy areas that I handled was mainly respiratory, because that was my primary interest.
Yeah.
So I worked for some like asthma medications, COPD medications, being responsible for them. COPD is the chronic obstructive pulmonary disease, of course, as you know, which is usually a disease that happens to people that tend to smoke for a long time. They begin to have some kind of, to simplify it, a mechanical problem with the lung mechanism. So with all of this interest into respiratory, all of this experience into respiratory, Sharp had also quite a very interesting lineup that's related to respiratory, and they have their own patent technology called Plasmacluster technology that deals with the protection against airborne viruses, airborne bacteria, airborne allergens. So for someone who's asthmatic, interested in asthma, interested in respiratory, would like to help other people not to suffer from something that he saw during the childhood, that was a technology that I knew that it will benefit the world very much.
Okay, good. That is now, yeah. But in the past, so you experienced this, how it feels to be asthmatic, and there are two types of asthma, as far as I know, the intrinsic and the extrinsic asthma, or maybe they are somehow combined. There's a lot of psychological component involved in this. And especially some people, they don't feel well in certain environment, yeah, because something is in the air, some dust, some particles or so, that is really affecting them a lot. And how was it for you in your childhood? What did you do? Did you avoid allergens, or what did you do? Or are you allergic?
Yes. So the first thing that for me, I'll talk first about my personal experience and how it should evolve. So for me, for example, at that time, the whole medicine for the asthma was not very advanced. So at childhood, asthma was very underdiagnosed, if I can say so, in Egypt at least. So it's being treated usually as if it's a cough from some kind of reason. It's either viral, bacterial, whatever. So there was over dependence on antibiotics, for example. Then by the time, of course, the whole science developed more and it was more understood. When I grew older, I began to meet pulmonology doctors that will diagnose immediately and treat the underlying cause of the asthma. And then I began to have the proper
May I
treatment.
interrupt you? What could be the underlying cause of asthma? What could that be? Is that just like infection, or what would be the underlying cause that would be treated?
Asthma itself, it's an inflammatory problem. There is a certain inflammation that happens in the lung and it creates all those related symptoms.
Can that come also from stuff that hovers in the air, that you get the inflammation from invisible particles that are in the air that you inhale?
Exactly. So for this inflammatory or inflammation to happen in the lung itself, you need a trigger. And for the asthmatic person, you can say he's some kind of an allergic person in general, he can get this inflammation being triggered from much simpler causes that will not trigger to the normal person. This includes the dust, of course. This may include the pollen. This may include other types of allergens that are related to food or other airborne allergens. Of course, there have been many studies that are guiding that viral infections, bacterial infections, warts, the respiratory.
Sorry that I interrupt you, because you're so scientific. I just wanted to. So what we can actually summarize for everybody who's listening to us, that when for example, a child has asthma and the pulmonologist would treat the underlying cause, it includes, or it is always inflammation, and it includes also particles that are hovering in the air that could be the reason for the inflammation. It's possible, yeah, that it's like
True.
This, yeah.
If we want to summarize it in an easier way, if a child, for example, is having a repeated episodes of not being able to breathe easily or coughing, especially at night, then parents should think this may be asthma. This is where they need to go to the doctor and describe the problem exactly as it is. Because to understand that there is asthma, the doctor depends very much on the history, especially with the children. Once the doctor knows, of course, there is a certain cycle that he needs to follow in the treatment. Includes, of course, the medication that he will adjust to the patient. But part of this cycle, as being mentioned in many guidelines, is the environmental or the non-pharmacological approach. This means, as you
the
mentioned,
reason why I'm asking that is actually, I have a lot of patients, the pediatric patients that I see in my clinic, I'm an E.N.T, are often having adenoids. It's very, very common. In Arabic, it's called lahmia, I think.
Yes, exactly.
And I mean, my understanding of the airway is, of course, if the airway is blocked with infectious tissue that is blocking the interchange between nose and throat, and the child is basically forced to breathe with the open mouth, that this causes also inflammation. And this inflammation, and also that it causes unfiltered inhalation of particles into the bronchi, and additionally frequent choking and so on. So I see often that children get this kind of or the symptoms of asthma also due to adenoids. But I don't want to go too much into this because we are just talking about the reason why we both are so interested in the upper airway. And now for me it's also the nose. There's also allergic rhinitis. So there's not only allergic asthma, there's also allergic rhinitis, and that's where we both meet. And people with allergic rhinitis, they often sneeze a lot in the morning, for example, or they get a blocked nose when they come to a certain environment, again, an environment where certain particles are hovering in the air. And for the allergy treatment, I have basically this concept with the three pillars: the hereditary background to develop too much IgE, which is basically running in families, yeah, and then the inflammation that needs to be somewhere, and then the presence of an allergen. And if all of them come together, it's a possibility to develop allergies. But on the other side, also, if you want to treat allergies, you need to erase each one of them in order to get a good result. Do you see it like this as well?
Of course. So, first of all, when you talked about allergic rhinitis and asthma, you will be amazed by the number of patients who are having both the problems together. Because usually with the rhinitis also, as you have mentioned, when they wake up sneezing, this means that for some time when they were sleeping, they had a lot of secretions that was going from their nose down to their throat and then down to the lung, which causes problems for them. This is one of the reasons why they have the problem at night. But as you have rightly mentioned about the allergens, just to simplify it also for the audience, allergens is any thing that can cause you allergy. It can be something in the food. This is why there is the most common allergy that's known as the food allergy. This is why the children, for example, some children may try to avoid walnuts or certain type of chocolates and so on. So avoiding the allergen itself plays a big role. This is either in that you try to knock out the allergen from your daily routine. For example, if someone is allergic to bananas, they stop eating bananas. That's the first thing to do.
Yeah, it's easy. But it's also easy. I mean, if you know that you're allergic to bananas, it's easy to get them out of your life.
Exactly. The more difficult part comes when you cannot control those allergens that are around you, which is something that has to do more with the something like the airborne allergens. If you wake up at one day and it's dusty outside and you are allergic to dust, you cannot control this. You cannot stop the sandstorm from happening. But what you can do is that you can try to create a secured area for you, a healthy area for you where this dust is not reaching. This is why by default you see most of the patients that are having such type of an allergy, when they see that there is a huge dust amount on the outside, they stay at home. They do not leave. They don't know why is the whole sequence at some times for an uneducated patient, but they know that this is bad, I'm avoiding it. The second part is, of course, what you have mentioned. There can be some kind of tools to desensitize or to decrease how much this allergen would affect you. But again, this would come less when it comes to the airborne allergens, as in the typical like dust or pollen or such things. A bigger problem with the airborne allergens is that it does not stop at the allergen site. It also includes airborne microbes. So for example, if there is an asthmatic patient or a rhinitis patient, they're doing fine, they're avoiding the dust, they're avoiding being in the pollen or whatever. But I have my son, for example, goes to school, he comes back and he's having the flu. This is a virus that eventually there is a high probability it will reach me and I will get the flu as well. So once I have the flu, the infection will start, which will cause an inflammation again. Both in your nose and your lungs.
But I don't believe that the phlegm from the nose runs directly into the lung. I mean, I think we would choke, we would cough. We have this fine sensor in the larynx that would make us cough. So I do not believe in this. I think that people who have a blocked nose rather have the problem that they need to breathe with the open mouth, and that they get dryness in the throat, and then that this dryness causes again irritation and cough. But I don't know if it's really happening that the bacteria go directly to the lung. However, I mean, we know that obviously if you have a high bacterial load, or let's say a high viral load, the viral load is so, I mean, virus is so small, it comes through in nanometer, I think, and it is inhaled like molecules. Yeah. So basically, I have now inhaled definitely your viruses, and you have inhaled my viruses, and that's a natural way of life. Yeah. If we inhale, we inhale. Yeah. It's anyway the task of the nose to prevent us from getting sick from that. Yeah. And if the nose doesn't work properly, then maybe we will be also more prone to get throat and larynx and maybe even bronchial infections. That's how I see it. I don't know. You, from the pharmaceutical side, you focus probably on the steroids and on the antihistamines. This-
For us, of course, our study goes more towards the pharmacological approach and how to treat the problem after it happens. But of course, from a pathological point of view, if we mention that, how the problem happens from the early beginning. This is not only from the pharma school, but also due to my type of work and the type of products that I usually handle. I have to be updated with the guidelines. What I can reply with to this is that you are absolutely right. There is so many defense mechanisms when it comes to the nose and the whole airway before something would reach the respiratory system.
Yeah.
But it's, again, if you talk about asthma in specific, it's a multifactorial problem. There is a lot of things that will happen. If one thing malfunction, the other may not be able to step continuously to support what had malfunctioned. To give an easier example about what I'm saying, if you are continually breathing from your nose in a very proper way, you may still have a flu.
Yes.
You may still have some kind of a viral infection that reaches to your respiratory system.
Yes.
Which means that, yes, there are certain mechanisms that are in our bodies that are preventing problem from happening, but still problems may happen.
Yes.
This will be very individual based analysis if we go into this. Why it happened to you at that time? Why it happened to me at that time? Viral load, bacterial load, of course, the amount of microbe or the infectious reason that you are being opposed to will play a big role. And we have seen this especially during the COVID-19 as well.
I have a theory about this. I mean, as far as I know, in the lung, we don't have any immune response. We are incapable. Once any germ reaches the lung or the alveoles, there's no chance that we can beat it with our immune system. And I believe that therefore we have all this immune potential in the upper respiratory tract and especially in the nose. And we are better off if the nose gets hit by some droplets or so, and then we develop the response. And I think that's the individual thing, how good the response, how good the immunity in the nose of everybody is, in order to protect our lung. This is my
I think this is also
story that I like to tell. Yeah,
you work in the E.N.T, so this is part of the specialty. So this why.
Yeah.
But the point is, there are of course defense mechanisms in our body reaching even to the blood. We have the lymphocytes that will fight against any bacteria, even if it reaches down the stream to your inner body. But what I would 100% agree with you on is that you are having multiple gates through your body, and the nose in that case is the first gate.
Yeah.
So the earlier that you can eliminate
Yes.
the threat that is coming is the better, because this means that you triggered everything inside less.
Yeah.
So there is no inflammation that reaches to the lung.
Yeah.
So there is no asthma by default. There is no flu that reaches
exactly.
inside, and so on. So of course, one of the most important things for any patient who's having a chronic respiratory problem is to manage properly how healthy is his gates.
Yes.
That's why if I have an asthma,
Exactly.
it is very important for me to understand that first my nose is functioning well. I know how to breathe,
Yes.
right?
Yes.
Because many of the asthmatic patients, especially children, that even happen for me, I'm not used to breathe from my nose.
Yeah.
I'm used to breathe from my mouth because I get the breathlessness. I cannot breathe properly. I'm trying to what I'm thinking of is that I'm trying to get more air because I cannot have enough air to reach inside my lung. So I have to open my mouth and I try to take the air inside. But a simpler education to know that actually asthma does not mean that you cannot breathe in. Asthma is more that you are having air inside your lungs that you cannot breathe out. And this is why the capacity of your lung to take new air is less. So if you learn this, you learn how to breathe properly and how to utilize your nose and how to decrease the cold air going to your lungs to irritate it at like late nights, as you have mentioned, this plays a big role. I'll just give one example about one of the medications that I used to handle. That one was mainly for what's called as exercise-induced asthma. With the exercise-induced asthma, this was something that I didn't know in detail until that time. But what I found that the exercise-induced asthma as a term, it means that the patient is typically not asthmatic. Many patients are typically not asthmatic, but when they tend to exercise, they need more air to breathe in. They begin to have the higher rate. So when they run, they begin to open their mouth to take the air through the mouth, not through the nose. And by doing this, they are getting suddenly a cold load of air going down to the lung. And this irritates the lung because the lung was not used to this cold air. You are used all the time to breathe from the nose, and then suddenly you are pushing the air from the mouth. So for this, away from the medication, a non-pharmacological approach that I would properly say is that you do like how usually your coach will say, breathe in from the nose, breathe out from the mouth if you would like to. But your breathing in, it must continue from the nose because you maintain to have the warm air and you maintain to have all, as you have mentioned, the defense mechanisms that are in our noses in order to prevent those airborne allergens or the cold air or whatever is related to reach to your lung easily.
So that's really a very good advice actually for everybody who likes to run or likes to play sport or is in the gym. In through the nose, out through the mouth, because the mouth helps us to get rid of the old air as quick as possible and as easy as possible. But the nose is, I always compare the nose with a security gate at a building like insurance company or whatever or bank. You don't want to have everything open, and if you have something precious inside, you don't want to keep the house wide open or so, and you also don't want to have a small door because you want to have some customers coming in.
Exactly.
So then they design special doors with special security cards and video camera and everything. And I think this kind of process is happening also in our nose. There are many hints for that, also why we cannot sleep well if we don't breathe through the nose, and why the nose is so tightly connected to the brain. In fact, actually, it has a direct link to the brain. I remember we were talking about this as well,
True.
And we need to make a second podcast about all this. So this is so super interesting because also our body surface is a fraction of actually that surface that is inside our body. If you just look at the lungs with 70 square meter surface, 60 to 80 square meter surface, and our body size of 1.5, 1.8 square meter, depending on how big we are. And that shows actually that this inner field needs to be protected.
Exactly.
That is where we need the protection, and it is a really sophisticated system which cannot be topped by any mechanical filter that we put in front of our nose. In fact, actually, it would probably counteract to how it works, but it's also another topic. But what I kept in my mind was I read this article about how in Bumrungrad Hospital in Bangkok, how they protect their sensitive patients from infections with either virus or other particles that are hovering in the air in their infectious diseases department. And that's how I first came to know that there is this device called a Plasmacluster. Apparently, they built this in the ceiling there, and apparently they have sterile air. So how does that work actually?
Perfect. So this will bring us to something that you have mentioned at the beginning. Why I'm there at Sharp? Why a pharmacist is there in a company that's mainly responsible for electronics? Plasmacluster technology is an amazing technology. When it came, actually, it's a pioneer to all the ionization technology. But in order to properly explain about the hospital, I will have first to shed a light about what is Plasmacluster technology. There is a concept called air purification. The idea of the air purification is simply that it's same like the water purification. You are trying to take the impurities out of a certain medium. So if there is, in the water that you drink, if there is dust, you need to take the dust out. If there is chlorine, you are trying to take the chlorine out. If there are bacteria or fungi, you are trying to take them out. And this is why people are used to the idea of either using bottled water or they use certain filters at home. The same thing applies to the air as well. In the air that we are breathing, there are many impurities that are there. This, as we have mentioned, includes the allergens, includes the dust, includes some types of viruses, bacteria, and so on. So to do a proper air filtration, there have been many stages in the evolution of those technologies and those mechanisms. I would focus now on the Plasmacluster. The Plasmacluster concept is that you need to be protected with a certain mechanism, regardless where you are inside your room or inside your hospital or inside your office. And to do this, what the Plasmacluster technology do is that it creates some kind of an eco-friendly recycling of the water vapor, where it utilizes the water vapor in the air in order to be broken down into certain types of ions. Think about those ions as something like the antibiotic inside your body. The idea of the antibiotic inside your body is that if you are having a bacteria inside your body, this antibiotic will go ahead and break down or kill this bacteria. This is the same concept that happens in the air with those ions. Those ions are kind of an antimicrobial or an antiviral or an anti-allergen that can, through certain mechanism, break down.
But they will also become heavier, the particles. I think what I read is also that it's not only broken down, but because water from the air humidity, will circle around that particle, they will sink down to the floor. Is this correct?
There are multiple mechanisms that will happen based on how the device itself is being installed or how the technology is being delivered to the hospital or to the end user, like at home. But the core thing is about killing or eradicating the virus or the bacteria or the fungi or the allergen. You have something organic that's completely intact. Think about it like if the virus is wearing an astronaut suit. This is to balance the pressure inside his body with whatever is happening outside, the less pressure is having. What the Plasmacluster does simply that it ruptures a part of this astronaut suit that the virus is wearing. Once you break down one part, what happens to the body of the astronaut is that it explodes in the space because there is no pressure that can hold what's inside. Same like a balloon, for example. This is what the Plasmacluster does in the core. With this, in many type of hospitals, they are installing this along with complete solutions, for example, that can include HEPA filtration, can include carbon filtration, can have humidifier function, and the humidity increase will help to create a heavier weight around the virus and pull it down to decrease the possibility of breathing in. But this differs from one place to another. Like, for example, for the hospitals that we have here in Dubai, we are not usually advising to proceed with a unit that has a humidifier because already we have high humidity levels. But in some other areas that we have installed units, let's say near to the desert area where it is very, very dry. This is where we would advise through our consultants to include a humidifier to help with the mechanism and ease in the breathing in general. So for the hospital that you have mentioned in specific, that hospital, the concept of hospitals in general to include Plasmacluster as part of their mechanism is that there are many places where different types of patients may be existing, not knowing the problem of each another, and they may end up infecting each one another. To simplify this, there is a concept in the hospital called cross-infection. The cross-infection, that this means I'm having a certain disease and I'm going to the hospital. I'm having flu, for example.
I always say there are only three most dangerous zones on the planet are the battlefield, the road traffic, and the hospital.
I would put hospital on top.
Yes, most likely, yes.
If not well maintained, of course, this may happen. But the good thing is that at least because we are talking here from Dubai, there is amazing regulations that are always in there for most of the clinics and the hospitals that they're following, which is called infection control.
Yes.
And the infection control department actually is playing a huge role. Maybe the people outside the hospital do not know, but simply to say, if you go to the hospital, again, the same example, if I have the flu and you are going there because you have, for example, a pain in your arm, once you leave the hospital, if you leave without getting the flu from me, this had been the work of the infection control team. This is the hidden soldier back there. He allows you to go to the hospital and walk safely inside the hospital, although you are surrounded by many patients that you don't know what are they suffering from.
Yes.
But you do not get that disease. You don't get this cross infection. The infection does not cross from my side to your side. Plasmacluster technology is one of the cornerstones in the hospital in Bangkok that you have mentioned. The idea was to install units that can release plasmacluster ions, the ions that you have talked about, that they can kill the viruses and the bacteria and so on.
But aren't these ions also dangerous for me to inhale them?
No, the ions typically are the whole patency actually that we are having for those ions. It includes a couple of points, but the most amazing point of them is that how to create it to be able to break down viruses and bacteria, but nothing more complicated. But they are so weak to create any problem for any complex organism. They, for example, if you put ions around you, you will not come one day and you cannot find your table. Or you find that your skin is disintegrating. It is powerful enough only to break down a virus, to break down a bacteria, to break down an allergen. Nothing more, nothing less.
And I heard also it's mainly inside the device where it's most powerful, not so much outside. That's why you have to ventilate the air through the device. Is this correct or is this not?
For air purification systems other than Plasmacluster, I would say this is correct. Because the idea is most of the air purifiers are dependent on having a filter inside them. And there is a certain fan inside that creates an air cycle, same like the AC, for example. There is an exhaust where you try to suck the air inside the device and then you push the air again outside. So the idea is that you have the air pass through the filter itself. Whatever is bigger than the filter pore size will be trapped. So you can partially block all types of, for example, like dust, pollen, maybe smells if you have certain type of carbon filters. But you push the air again, it is relatively clean. Most of the microorganism is still there. But with the Plasmacluster, you have a dual mechanism. You have the filtration system inside the device, and you also produce the ions to reach outside the device. So this means if we put the device in the corner of one room and I'm sitting at the other corner, the ions will continue to be produced, Plasmacluster ions. They will fill the air of the room. So if anyone at any place in the room sneezes, for example, before the virus will reach me, it will face thousands of ions on the way to reach to me. So you are protected from this type of a microbe.
Well, that's amazing. That's really amazing. I mean, that I should have this in every room. It's really good.
We see actually many hospitals adopted this globally, and especially in the places like the waiting areas, for example, because this is one of the most dangerous areas. All the patients are waiting together. For example, if they're visiting a general practitioner, no one knows what the other one is having. At the time of the COVID-19, for example, how many were staying in a waiting area having COVID-19 versus how many were there just for an irritable bowel syndrome, for example. So they all left with the COVID at that time.
I think there's also another advantage in this. Please correct me if I'm wrong, but I think the plasma side effect of these ions is also that they not only neutralize, let's say, dangerous substances, but also foul smelling or bad smelling molecules or particles that are hovering in the air, correct?
Anything that has an organic nature in a microscopic point of view can be neutralized by those ions, the Plasmacluster ions. But for the smells especially, usually what we do is that there is an extra feature that we add to many of our units, which is a dedicated carbon filter. The carbon filter idea, carbon in general, it plays a big role in taking in like the gases and the bad smells. The Plasmacluster ion will add a huge benefit when it comes to something like the volatile organic compounds, smells that may come from petrol, for example, or if you are at home, maybe the nail polish that can be used at home. Those type of organic smells are better to be broken down by the Plasmacluster ions because their nature is organic. So you need to break down the chemical compound of this smell before you suck it inside this carbon filter. So this is why if you read the papers, you'll see that there is so many papers that are talking about the benefits of Plasmacluster technology for bad odors. But this is mainly for the organic compounds, while for non-organic compounds, then there will be the combination between the Plasmacluster technology and the carbon filtration as well.
Yeah, I heard also that some hotels are using plasma clusters in their rooms when somebody was illegally smoking in the room or so.
Actually, the applications of this technology is one of the endless and the applications that maybe you will be using without you knowing that is there. So, for example, it is at hotels, it is at many cars. There are cars that are being sold and having Plasmacluster technology as part of the option.
Really?
Certain brands of cars, like the higher end cars from Toyota manufacturing and Nissan manufacturing, like the Lexus and Infiniti, many of them are having one of the options in there is to switch on the Plasmacluster technology. This is
amazing.
A kind of cooperation between Sharp and those companies on a global level. If you go to many airports, the elevators, because it's a small area where many people are staying, in the AC system, Plasmacluster technology had been installed. So Plasmacluster technology is owned by Sharp, but it had been offered through many solutions, even outside Sharp. If you look at the matrix of the number of products that is there around the world with this technology, you'll be amazed. I had been in Japan because, of course, I'm working with Sharp, so I have to go to Japan. And one time I was in the bullet train. And actually, after I left, I was talking to some colleagues, and what I knew that the bullet train AC system for many of the trains is having Plasmacluster technology installed in it.
So no
in
smell.
order to create no smell and to create a protection, because there will be some time where you are with people from around the world, same like me. I landed from Dubai, someone landed from Africa, someone landed from Europe. We are all there. And of course, there is the people of the country themselves. No one knows who's having what type of virus. So you create a protection for all the passengers that are there.
That's
with
amazing.
Such a thing.
That's amazing. It's really amazing. I mean, I'm so happy that I have you here to explain this technology, and I'm actually glad that I found out about Plasmacluster, because it was never on my radar to think about technology to prevent in preventive medicine. But here it is very clear that this kind of technology is helpful for anybody who is potentially allergic, who is very sensitive, has these sensitive noses, maybe not even allergy yet, but for some reason, often inflammation in the nose or breathing difficulties and
Actually,
when you say nail polish, for example, I know some people who are extremely sensitive to this kind of odor also. And that gives really a good option, I think, for those people to have that installed in their room. Would it be good to have it in the bedroom, or in which room would you suggest to put it, or everywhere?
The best case scenario is that if you have it everywhere, of course, that's the best that you can do. But our advice is usually, because of the practicality also of having it, is keep it where you stay most of the time.
Which is the bedroom.
It's either up to your daily routine. So for me, for example, I stay most of the time at my office. So I have it at the office. Other people may stay most of the day at the living room with their family. Please put it in your living room. If you can put it in both the living room and the bedroom, that's amazing. People who are having more than one child and they're sleeping in the same room, which is the typical at the younger age for most of the families. Please put it there, because it will definitely help not to have a cross infection between your two child, especially if there is one that goes to school and the other one is preschooler. They don't go to school yet. There are even solutions that can be placed in your car when you are driving.
Exactly. I wanted to ask you about this, because unfortunately, I don't have one of those cars that you were just talking about. Is there a solution that I can upgrade my car with this?
You can add this as an add-on. So the beauty of what our research and development team did in Japan is that they created or they formulated this technology into so many different solutions that can be customized to your daily routine. So you will find that there are ready-made plug-and-play units to be placed exactly for a bedroom with a certain coverage, or for your living room, as well as for your car. There are options that can be placed in your car cup holder. You plug it, same like you plug the USB for your mobile phone. It gets the power and it begins to generate the Plasmacluster technology ions into the car itself.
Wow.
So I would say that whatever is the need, you will find a solution.
Sherif, I need to get one of those. Where do I get it? Here in Dubai, are you having some outlet here?
In Dubai, of course, it's available. You'll find it over e-commerce. We are available over the e-commerce platforms in general, led by Amazon over here, of course, due to the typical usage. You will find it in major consumer electronics outlets like Emax, or in hypermarkets like Lulu. It is available. We have our local partner here in UAE. Their name is ITL Cosmos. You can contact them directly, or you can reach to our website. We have a section where you can raise a request or a question about Plasmacluster into that section. Let us know what is your exact need, and we will immediately email you back how you can get this, or we can put you in direct contact with our local partner. For even this solution would be even beneficial for people who would be hearing the podcast outside of UAE. You can, at any country through the whole globe, you can reach to the Sharp website that is relevant to your country. For the whole Middle East and Africa countries, there is one website which is SharpMia, sharpmiddleeastafrica.com. You can reach to, you can just go to contact us, put your inquiry about Plasmacluster. It will reach to someone from our team. They will immediately reply to you back.
That's amazing. And I think we will put this vodcast. Did you know that it's called vodcast?
Actually, yes. But I think that's a new term, I think.
Because it's very new. But I Googled it, and yes, it's called vodcast, video podcast. So we will put this on our website and also on YouTube. And I will put the links. You will give me the links, so that anybody who's interested can just click on that link and then get in contact with you and get their solution for this.
Sure, definitely.
I'm sure this is really, for most of the people, interesting, actually. Yeah?
Actually, people should be more caring about the quality of the air they're breathing, because there have been, in the recent years, so many updates about the air quality and how it affects your health in specific. You will find, if you go to the WHO, there have been reports published in, I think, year 2014 to 2015, if I'm not mistaken. It is related to the number of deaths that happened due to ambient air or indoor air quality problems. What you'll be amazed about, that the ambient air number of deaths was per year around 3.7 million. But for the indoor or the household air, it reached to 4.3 million, which means that the indoor quality may be worse than how it is on the outdoors. The APA in USA, which is something, if the people are more familiar with the term FDA, the Food and Drug Administration, there is the APA, which it handles more about the environmental conditions and how to help towards this in USA. There had been many reports coming from there that the average difference in the quality between the indoor air and the outside, in the indoor, the air quality is worse by 2 to 5 times.
Yes.
And in some conditions, it may reach to 11 times even, which triggers, again, the idea that you need to check about your indoor quality very much.
Which is another topic, and I hopefully can invite you soon again Definitely. For another podcast, and then we talk about this air quality, because that is, that we have actually in Mueller Medical Clinic, we have an emphasis on anti-aging. And if you just mentioned that the air quality is so super important for our life quality, not only but also for our health, and hence it's also important for our longevity. I think this is it's an interesting topic we need to discuss further.
Sure, I think it will take a long time.
Yeah, I think so too. Yes, but thank you very much, Sherif, to come for this podcast. It was really a pleasure to have you here.
Sure, it's a pleasure to always meet you. Thank you. Thank you so much for having me. Thank you.